basic 3 tools that we're going to use. So first is our needle driver. And here it is. I put my thumb and middle finger into the ringlets there, and you see the serrated teeth really help for grabbing the needle. And I typically use my index finger for stabilization of the needle driver with rough or really dense tissue, things like that, as you see here. And let's go ahead and load our needle. Alright. I think more self-explanatory are suture scissors. We cut the sutures when we're done. And lastly, our tissue forceps. Here we have some Aston tooth forceps, but you can use one without the teeth as well, and they're less damaging to the tissue. Here I'm trying to show you that you should be pinching kind of like that, and your Astons or your forceps should be an extension of your left hand. You can grab the needle, you can manipulate tissue, all of that with these.